One of the most distressing things you might have to do with your pet is CPR, cardiopulmonary resuscitation. We do cardiopulmonary resuscitation when your pet is not breathing and has got no heartbeat. So what we're going to do is have a talk through on the theory of doing CPR. So the first thing we need to do is identify that there's actually a problem. So you might come across your pet, or it might be that the pet is drowned or electrocuted, and you find that they're not breathing and you start to get into a bit of a panic. Now, when you're doing CPR, this is not an easy skill to do. The physical act of doing it is easy, it's more the emotional side is very, very difficult. We hope no one will need to do this. So what we're going to do now is have a look through the whole cycle of doing pet CPR. In this example, we're going to do it onto a dog, but doing it onto other animals is pretty much the same. So to start with, we need to find out if the dog is breathing. So you can tilt the head back slightly. You don't want the head far forward because that can actually block the airway. So tilt the head back slightly, and you can rest the head or leave it laying on the floor. And we're listening and feeling for signs of circulation or signs of breaths. So to do this, you pop your ear right down close. You want to keep your ear close because you want to make sure you can concentrate what you're doing and listen to any signs of breathing. And you can look down the body. And as you're looking down the body, you're looking for the chest to rise and fall. You can also place a hand over the stomach and the chest, so you can see if you can feel it rising and falling. And you're looking for what's called normal breathing. Now, we do this for 10 seconds, and it's worth doing it for a whole 10 seconds. And the way of making sure of that is to speak it out loud. So actually count up to 10 slowly. In that time, you should hear a breath. If you do hear a breath at that stage, then the dog is breathing. So this is a point definitely we need to get them to the vet as quick as possible. But just because you hear them breathing now, you must monitor their breathing the whole time, just in case they get worse and the breathing stops. If you don't detect the breaths, you need to start off with some breaths into the dog. Now the idea with CPR at this level is most of the time, the reason the dog is not breathing is a respiratory type problem. If you're looking at a human, and they're an older human, it's highly probable if they've gone into cardiac arrest, which is a heart problem. And this may be that the dog is drowned or electrocuted, or maybe through illness, its breathing is just not strong enough. So what we're going to do to start with is give some initial breaths. How we do the initial breaths is to grab hold of the tongue and just pull it out to one side and close the mouth. What we're doing here is pulling the tongue from the back of the mouth and also sealing the mouth, so that when we're doing the breath into the nose, we know that the air is not going to come straight out the mouth. If you can't grip hold of the tongue, or sometimes cats' tongues are quite hard to get hold of, you can use a gauze pad, a bit of bandage, tea cloth, or just a bit of your clothing, just to grip the tongue and just pull it to one side. We're keeping the airway open, so it's not forced down, and what we need to do is need to deliver breaths. Now breaths are going in about 1 every 6 seconds. And what we need to do is put the breaths in by sealing your mouth over their nose. Now some breeds of dogs and cats might have a very small mouth and you can actually blow in the mouth and the nose, but most of them you would need to seal the mouth and blow into the nose. So by sealing around the mouth here, you get your mouth down there and you're delivering the breaths. And the whole time you're doing this, you're monitoring, seeing what's happening. Now you will see the chest rise and fall. You don't want to blow too much in. So once you see that chest rising, usually in about a second or up to a second, you'll see the chest rise and then let go, come away from it, you'll see the chest fall. And then it's ready to put the second breath in. If you hear the dog breathing for itself or getting up or making noises, you just stop. Don't carry this on if you know the dog is then breathing. The next thing you need to do is find out if the heart is beating. So depending on the situation you've gone into, if you brought them out of the water, it may well be that you can give them maybe 5 breaths and then see whether they've got circulation. Or in other instances, you might want to do a circulation check sooner. Now in other videos, we've looked at checking the pulse of your dog, and this is what we're doing here again. Taking our fingers just inside the back leg, and we're feeling for a pulse. Don't put your thumb on the top because you might find that you feel the pulse through your own thumb because you've got a pulse point within your thumb. So just your fingers loosely over there and you're feeling where the artery goes over bone, and you should feel a pulse there. We're doing that because it's the main femoral artery going down the leg, so it's one point that should, even if the heartbeat is very weak, you should be able to pick up a pulse. Checking the pulse is something you can do on your dog just to practice now. If you don't get a pulse, we then need to do chest compressions. Now, chest compressions are delivered by placing one hand in the centre of the chest. We roughly work out where the elbow is when we bent the leg back. So if you take your dog, you can practice in your dog now, just tilt the leg back. Where the elbow goes is where your hand goes. We normally lay them onto the right hand side because, like with humans, the heart is set to one side, so the compressions are much more efficient if you can lay them onto their right side. You can place one hand down in the centre of their chest. Now, if you can't push down with one hand, you can use two hands. Just grip your fingers together and use two. So it depends on the size of your dog, and it depends on what size you are. Now, the compression rates have been brought in line more with human first aid, so they're much easier to remember. So we're doing 30 compressions, 2 breaths, 30 compressions, and we carry that on. When we're doing the actual compressions, what's happening is we're pushing down on the heart, and when you squeeze the heart, the blood inside the heart will be pumped out. Through the right-hand side of the heart, it's being pumped through the lungs, and the left-hand side out through the body. So while you do your compression, you push down to squeeze the blood out of the heart. When you let go, it sucks blood back in. So it's just as important as the compression is the release, because if you don't release the chest fully, then the heart is not going to be full of blood, so the compressions you're doing are going to be less efficient. Also, the speed of compressions. It's roughly done about 100 and 120 compressions a minute. This is the same as with human first aid. So it's set at that within first aid to make it easier for people to remember. If you go into more advanced CPR, you will look at doing different compression rates for different sizes of dogs. So if you've got a very small dog, you go for quicker, and cats, and larger dogs, it'll be slower. But within first aid terms, it's much simpler just to say one breath every 2 seconds, which is 100 to 120 per minute. So with the compressions down, we do the breaths, and then we come back, do the compressions, then come back and do the breaths. As far as how long do you do this for? If there's 2 of you there, then it's a good idea to swap over every 2 minutes. You could, if you can control the scene well, because sometimes this is not easy, is one person can do the compressions and the other person can do the breaths. But it's often easier for one person to do both and then switch over to the other one. If you had to do this for any length of time, your feet, your ankles are going to be hurting, you're going to get tired, you're going to get very upset. Then the other thing is, well, if you are doing these compressions, then the hope is that we can get them breathing again and they'll show signs of life. But when do you stop? And this is always a very hard one to say. There's been a lot of research done, and if a dog has been brought round with CPR, it's usually has always been within the 10 minutes, and it's virtually unheard of to be doing CPR for over 20 minutes. Survival rates with this. With pet first aid and pet first aid training, pet CPR and dog CPR is one of the big things people want to learn. The chance of this working will depend on lots of things. If your dog has drowned or been electrocuted, then it's possible that the percentage rates are going to be much, much higher because it's a respiratory problem. But research has shown that within a veterinary world where they've actually got a lot more equipment than you would have, the chance of survival with a full-blown cardiac arrest can be around about 6%. Again, that will vary on what's actually happened. So I'm sure you'd agree, even if it was 6%, this is definitely worth doing for your pet. Finally, it's a good idea to practice this. You can practice on toys and things like that, but never ever practice CPR on a real dog or a real cat. Also, if you've got a very old dog and the dog has stopped breathing and no cardiac output, then you also need to make a decision, well, is it right to do CPR? In other videos you've seen our dog Storm, and she was 18 and a half when she died. Now that CPR is not going to have any benefit there, and it's not really going to be any use to it. So look at the situation, assess the situation, and CPR is a very, very good thing to learn, and it's a very good thing to practice just in case you need it. And if you've had human first aid skills trained to you, then just with these slight variations, you can do CPR on your pet.